Let's review MyChart Bedside. 3 takeaways from MyChart Bedside. 1, how do you sign your patients up for a MyChart account? 2, how do you get your patients to use the Bedside app during their hospital stay? And 3, why would it be beneficial for your patients to use it? To sign your patient up for a MyChart account, you can double-click on the MyChart icon that's located next to their photo on the storyboard. This is a computer screen looking icon, just like in the picture next to it. If you double-click on that and it's green, they have an active MyChart account already. If it's blue, they have a pending one, and if it's red, they have declined having a MyChart account in the past. When you double-click, it's going to open up this next screenshot here, and you can send them a text or an email if they have a pending or declined or they've never signed up and they would like to. After you launch that to their phone via text, email, or print them off a code to use, just instruct them to follow the prompts that go along with that. And if they have trouble during the prompts, there's a phone number, a help number that will come up. Like if they have issues with a password, maybe they've already set up an account but they don't remember, they can call that help number and they will use an interpreter to help the patient finish getting their MyChart account set up. How do you get them to use it? So the first option that you have is their personal cell phone. They have to download the application to use MyChart on their phone. They cannot use a URL link for MyChart Bedside. It doesn't work that way. So the internet won't work, but the application downloaded to their phone will. In the application, they can use it in English or Spanish on their personal device. Sometimes, depending on the cell phone carrier or the Wi-Fi at times, it can run a little slower. So the next option would be using the Bedside tablet. This is provided by the Bedside RN. They're at the nurses' stations that you've seen. This only uses the MyChart Bedside application, so sometimes it runs a little smoother, but it does only operate in English at this time, so they'll need someone in the room who maybe speaks English or is a little more familiar that can help them navigate that. Here's how to assign a Bedside tablet.
So when you open up the tablet, it is going to be on the blank screen. And you're going to go into your navigators button and choose Bedside Tablet. You're going to want to make sure that the check mark is next to their name. And then you're going to click the Activate button. And then you're going to tap here and take a picture. You're going to click log in. Your patient is going to agree to all of the terms and conditions. It's going to ask if you want to set a PIN. Say yes, I would. I have been setting everybody up as 1, 2, 3, 4 just in case they forget and the next nurse might not know what you chose. This next question is, do you want to take a picture? No, thank you. And then they are inside of the Bedside app.
Your patient can order food.
With the spoon and the fork, she can order her meals for the day. It does take a second for the menu to open up. There's pictures just in case they don't speak English. If they go all the way to the bottom, they can choose the categories and add anything that they would like to their cart and then submit the order.
They can answer assessments and questionnaires.
You're going to find your Edinburgh screening and your pain reassessment. The pain reassessment automatically is sent to them 30 minutes after they receive pain medication. The Edinburgh, we do physically have to add to their MyChart, and we'll show you how to do.
They can do their education.
And so they can do the labor and delivery education, or they can skip directly to the postpartum education. So preventing falls Each one of these sections is translated. English is going to be first, Spanish is in the middle, and Haitian Creole is at the end. They're going to either choose I have more questions or I understand, and then continue to move on to the right until they get all the way to the end. Some of these do have files that they can make bigger to see pain options. Some of them will also have videos at the end. There's sometimes like a blue hyperlink. Once they get all the way to the end of the education, they're just going to click done, and it will automatically move this to the completed education section, which is going to be at the bottom, and then they can do the same thing for the baby's chart. And so they can do the labor and delivery education.
And they can also complete their Edinburgh screening.
Okay, so if you want to add an Edinburgh depression screening for a patient who is using one of the tablets, if you go to the tablet function and click Assign Questionnaire, you're just going to type in EDIN and it will pop up. If your patient is going to be completing all of their education and their Edinburgh from their phone, you will not have the option to assign the questionnaire here. So if you go to this little caret and choose Assign Bedside Questionnaire, you can get to the function through that section as well.